The Eastern Cape Department of Health, in partnership with Operation Smile South Africa and the National Department of Health, is this weekend delivering life-changing cleft surgeries as well as oral health services out in Mthatha. The Smile Foundation, working with academic hospitals right across the country, is offering facial reconstructive surgery for children with correctable facial deformities as well as burn injuries. And over the past 25 years, it has assisted more than 5,000 children to regain their smiles. Let's now welcome Camagwini Mavovana, the spokesperson for the Eastern Cape Health MEC, alongside Ms. Sarah Scarth, who's the Executive Director of Operation Smile South Africa. Of course, Camagwini, it's good to have you with us, and Sarah, good to have both of you on the show today. Welcome. So, Camagwini, myself and the MEC had a very similar conversation just a few weeks ago, right, about another life-changing initiative. And I remember asking if, of course, the department would expand the program beyond that particular 3 days and beyond that scope. Well, here you are with more progressive news. Tell us about this particular drive.
Good afternoon, Alicia, and good afternoon to the viewers. We definitely keep our promises, so I'm so happy that you actually remember that. But Alicia, as you would understand, the Eastern Cape has many rural and remote areas, and the Department of Health in the Eastern Cape, led by Ndandokazi Capa, our MEC, has really changed the landscape in the way in which we offer services, because we do understand that we have a lot of rural communities. So because we have a lot of remote and rural communities, the MEC has now focused on bringing services closer to the people. Mm-hmm. And this is why we we really collaborate with foundations like not Operation Smile, sorry. We partner with Operation Smile South Africa, mm-hmm. and foundations like this to ensure that we bring services closer to the people. So this particular project, much like the one we did 2 weeks ago at Frontier Hospital, really just focuses on that.
Absolutely. Sarah, wow, we really do appreciate your much needed collaboration with the Health Department. Welcome as well. So tell us how this partnership actually seeks to bring about meaningful impact to those in dire need of this life-changing procedures. We know this mission actually also coincides with the signing of the 3-year MOU with the department. How great an initiative.
Absolutely, Alicia. This is all about collaboration. Operation Smile South Africa, together with the Eastern Cape Department of Health and the National Department of Health, is delighted to be back in the province in this largely rural part of the Eastern Cape. And our work is very much focused on helping the department to deliver early access to specialized cleft surgeries, as well as comprehensive care. And that's where the whole involvement with the dental treatment and expanding that to be able to provide residents of Mthatha with access to treatments like fillings, preventative care, polishings, and all sorts of interventions provided by dozens and dozens of dentists and dental technicians, hygienists from around the country who have gathered here in Mthatha for the National Oral Health Congress, which took place on Thursday, and have now stayed on, given up their weekends to be able to serve the people of Mthatha alongside Operation Smile's around 30 volunteers. Our surgeons, anaesthetists, nurses are currently busy transforming the lives of 32 patients between today and tomorrow.
Wonderful news there, Sarah. Camagwini, I mean, let's talk about those lucky beneficiaries, which we know and understand is mostly children who really also need these procedures to have their dignity restored. Talk to us about how this process will then be facilitated, and how do those who still want to be part of the program ensure that they do actually get access and benefit from this initiative. You did say you are trying to bring services closer to the people.
We are, definitely. And we have brought services closer to the people. I think it's important to understand, Alicia, that, I think even last week when the MEC was on the show, she spoke about the backlogs that we have in the department. And because we have those backlogs, it's easy for us to draw from a certain database. Operation Smile obviously does also do their own findings, and they have their own relationships with the beneficiaries. But it was just really just so beautiful to see the beneficiaries really benefit from these surgeries today. We were physically at Mthatha Hospital alongside Sarah, and Sarah was just really taking the MEC through each and every single process, through each and every single program that has been, offered to those who need it the most. And the MEC really saw firsthand what bringing services closer to the people really means. Sarah was even just us through a couple of stories where children had not had these surgeries for 1 year, 2 year, 3 years, and how this particular facial aesthetic change will now change their lives. The MEC was also being briefed by one of the doctors, and they were saying that there are also cultural notions that are attached to a child who may have a cleft palate. And now that we are able to do these surgeries, we are now being able to kind of bring back those children back to society, and they're able to live normal lives. So yes, some of those beneficiaries do come from our database, but Operation Smile does really take care of the rest of that database that we have.
Absolutely, Camagwini. Now, Sarah, of course, the main objectives of this campaign is to ensure access to quality health care while also restoring dignity for children and adults with cleft lip and palate conditions. I mean, we know the challenge of quality health care accessibility, especially for those in far-flung rural areas. But I mean, you are also going beyond the scope and incorporating, as you mentioned earlier, nutritional support, speech therapy, and even psychosocial care. Are you also looking to go beyond the Eastern Cape at this stage? And Camagwini, maybe you can also respond to that after Sarah responds.
Alicia, absolutely. We're a national organisation and we go where the need is, working very closely with government so that whether it's in the Eastern Cape or other provinces where there's a great need, we will go. Our work really centres around a model where we bring specialists, all volunteers, to be able to work alongside the hospital teams at the designated hospital. But a critical part of what we do, Alicia, is skills transfer. Our goal is to be in a position where we don't have to go back, because we have helped to transfer skills, to impart knowledge, so that the local health professionals are able to conduct these surgeries independently. But we're very aware that this is highly specialized surgery, and so given the great need for our services, so long as we are needed, we will be here. And in terms of expanding, a child with a cleft not only needs surgery, but will need interventions by the dentist, will need speech therapy, nutritional support, psychosocial, in order to receive complete care. It's not just a single surgery, it's multiple surgeries for a child with a palate. Kama was talking about some of the patients that we've met. We had many patients who returned for their 1 year post-op, amongst them a 37-year-old man who received his surgery to repair his cleft lip only last year. He lived his whole life feeling fearful, hiding away, and the joy, the lightness in him. He honestly is alive. He was telling me that he now has a job and he has a girlfriend. Isn't that just incredible? And our goal is to ensure that every child born with this completely repairable condition never has to go through what someone like Zibuzele has been through, and that they will never remember these surgeries, and that their parents can know that they can access services so that their child can develop just like any other child that is not born with this condition.
Wow, doctor, that is absolutely heartwarming. And I suppose these services also being cost-free. I was about to ask you about what happens in terms of aftercare. You've just mentioned there that you do actually have follow-ups in terms of post-op. So, Camagwini, maybe just in closing, a very quick one from you.
Just in closing, I think we would like to thank Operation Smile and the work that Sarah does alongside her team. I think physically being there at Mthatha Regional Hospital and Nelson Mandela Hospital today really showed us the real strength of bringing together the private sector and government and being able to really bring these services closer to our people. I think that lives were definitely changed today. You also spoke about expansion. We're definitely going to continue to do that. That three-year MOU is definitely made for that specifically. We will not stop bringing services closer to the people, and our MEC in Ntandokazi Capa will definitely continue to make sure that the people of the Eastern Cape have the services that they need.
We
Thank you so much.
appreciate both of you. Sarah, we know that heroes don't always have to wear capes, so we really do appreciate the sterling work and the life-changing impact that you are, of course, affording to these people that need these surgeries. Ladies, thank you so much for this very impactful conversation there with Camagwini Mavovana, the spokesperson for the Eastern Cape Health MEC, as well as Ms. Sarah Scarth there. She's the Executive Director at Operation Smile South Africa.